Milton, and thank you for the invitation and allowing me to be presenting on the last day, so that clearly everything that you needed to hear and say has already been said and heard, but I can help recap. In particular, your presentation from this morning, I think, was help recap some of the important events. Thank you to you and your team, and a shout out to Harry for helping with the slides. Let me just say that innovation that endures, I think, is very much with what Milton was talking about this morning. Is, who's going to be surviving this revolution of innovation, and particularly in the area of telehealth. What are our solutions that are really going to engage members and ultimately be lasting for them in terms of supporting that improved outcomes? Clearly, again, recapping, and I totally agree with Cheryl and Leslie, the points that they make in terms of integrating these systems into the workflow process, but can we make telehealth solutions simple, personalized, as you mentioned, and also connected? So that, instead of every place you see provider optimization there, I'm going to steal Milton's comments of happy doctors. In other words, how can we decrease the burden to the healthcare team and improve that satisfaction, as well as a consumer experience? And health activation is what we're talking about, engagement. So ultimately, here we're going to talk about patient engagement. I'm going to have a couple of slides. I'm a family doctor. I'm a generalist. I started out working in San Diego in the public health service, doing general family practice, obstetrics, pediatrics, assisting in surgery, and was on call at 4 different hospitals on one night on every third night and so forth. So I'm very well entrenched in what the needs are of the family doc. And so that's part of how I look at this process when we're talking about stakeholders. I've been working in the employer sector for quite a while in the managed care system. So how do we look at employers as stakeholders and their needs, and how can we create a seamless digital-first solution? And again, these are just the introductory slides to show again that what works for the employers should also work for the consumers, the patients, and the doctors, the physician teams, the providers, to, in essence, facilitate and support their needs as well. And keeping those key stakeholders in mind, what we have done is to look at creating seamless solutions and leveraging as much technology as possible. As we see this convergence of exponential technologies, the decrease in computing costs and storage costs, the decrease in cost of genomic sequence. We saw the longevity team presenting yesterday on precision medicine. All of this has required us to increase our processing speeds and also increase our ability to engage all 3 consumers, but particularly the member, the patient. So I think that when we look at Care Anywhere telehealth, Anthem has participated in blockchain consortium at the national level with IBM and other stakeholders, and also the Internet of Treatment initiatives. So we're positioning ourselves to be a leader in telehealth, and so from that perspective, I had mentioned to Milton and others early that we want to create a digital-first platform. So what does a digital-first platform mean? It really means that when I take out my phone and I go to my app for my health benefits, everything I need is there. It relates to, from the employer perspective, a personalization perspective. Currently, we're using a Cast-Lite engine running in the back, so if I do any searches, information can pop up regarding those searches. In essence, all of my benefits are on my phone. If I need to do a video visit, I do it through my phone or my device. If I need to access, as Cheryl had mentioned, a doctor immediately, we're going to a geotagging capability, so it would show me that there's an urgent care across the street here. If wherever I'm at, it'll know where the best physicians and clinical resources are. And then on the the bottom circle there, in terms of partner integration, we're really looking at the best, partners to integrate with. And you'll see this on some of the slides when we're starting to look at engagement solutions. So a human-centered, digital-first approach really is an AI hyper-personalization approach that integrates both convenience, transparency, and ultimately integrates a seamless approach for all three stakeholders. And again, more intuitive for the patient, the member. It's at their fingertips. The employer is going to see higher productivity, lower cost if they digitize all of their benefits so that their enrollment is all digital. And then again, on the provider side, this is where I totally agree. Again, it has to be integrated into the workflow, but it has to be free virtual visits for the members, smart referrals to specialists, virtual coordination with the care managers, as Leslie had mentioned. And then, Milton, you had talked about the PBMs, and so there is also issues here regarding prescribing on clinically validated apps and pharmacy pre-checks. So this is something, again, that's really emerging on the provider side. Very quickly, our telehealth visits for adult and pediatric practices 24/7 is through our Live Health Online application. We've been using this for quite a few years, and we partner with American Well in this process and have a contracted national network. It's pretty simple. I won't show you pictures of my finger when I got a laceration and fracture from a bicycling accident, and videoed the picture to the doctor and said, now what? So it's very simple, easy to use, and we've had very good success with it. So the care goes where you go. I'm going to do 3 case studies on where we're doing integration and patient engagement. One is on virtual clinics for diabetes. The second will be cancer, and the third one will be obstructive sleep apnea. But these are, again, I just recently started working with our organization in the area of, as a medical advisor for our digital therapeutics solutions, and these are areas where we're exploring now. We did a 1-year pilot working with Verily and Google to look at a virtual diabetes clinic with continuous glucose monitoring. Again, as you saw this morning, we had the analytics identify over nearly 5,000 patients, of which 4,800 registered. We had 85% engagement onto the app. What was interesting, and 509 patients were using the continuous glucose monitoring, that they were in essence looking at their results on their phone and tracking. And you see on the bottom, what impressed one of the patients was that they had greater awareness that their food choice had a direct impact on their postprandial blood sugar. So A1Cs decreased in 65% of the individuals, and particularly if the A1C was greater than 9, they had an over 2-point drop in their A1C. And weight decreased in 12% of the individuals. The partnerships was with Google Analytics and Verily to identify and precision match individuals. We used continuous glucose monitoring through Verily and Dexcom. And then again, we had a virtual team, including certified diabetes educators, physical trainers, health coaches, and a software program. Another area that we're currently rolling out in 2020, we're the first plan to have a 24/7 virtual cancer care program. This means that it's a 24/7 physician-guided support for cancer care. Any patient with cancer is going to receive a kit at home called the TytoCare kit, which allows remote monitoring in the home setting, and they'll have access to a virtual second opinion. About 36% of skin cancers actually are misdiagnosed on the first diagnosis. And a Mayo Clinic study showed that about 88% of the patients who seek second opinions for cancer at the Mayo Clinic, their cancer diagnosis has changed. So virtual second opinion is critically in this program. And again, we partner with the top US cancer centers. The TytoCare technology, in essence, allows data to be streamed directly to the providers. So any patient who's having problems and does their exam at home and says, I want a physician consult, that immediately goes to Live Health Online, and that data then is incorporated into the cancer care program. Ambient monitoring, again, Milton mentioned this morning, just the key highlights of that. This is the future. We're doing, with our own associates, our own employees, a pilot talking about obstructive sleep apnea and using ambient wearable smart sensors. This is, again, AI-driven platforms, and it's what we see as the future. Thank you. I have a minute for questions, but I also want to thank Milton again for scheduling the session here in Fremont. It allowed me to work out of our Palo Alto office yesterday. So that's
Thank you so much. Any questions? Erica?
over here.
Speaking here as someone that's very...
Yeah.
Speaking as someone that has worked a lot with American Well, very aware of Life Health Online, you're showing, and I think you have some great things. You already collect a lot of data, say that's all there. A major issue with platforms such as that, and why I wonder how you're using it, is you don't have the ability to screen share, to draw, to educate using that online platform. How are you able to use all that data you're doing to be able to showcase to patients how you're making those decisions? I think that's just a limitation of what's on the platform. I was wondering what Anthem's doing to try and combat that or use it in a more efficient way.
Yeah, a good point, and I think that we work very closely with the American Well team. Currently, John Jesser is our liaison in that program, and I don't know any recent updates on screen sharing, but I do understand, at least from the perspective of my experience, that anything I have on my phone I can share immediately. But you're talking about additional levels of screen sharing.
Of just being able to share, I've collected all the data, I'm reviewing it, I want the patient to follow me through my thought process.
Okay, good suggestion. I'll follow up with, and I'll be more than happy to talk with you offline on what we can do for that. Yeah.
Thank you.
Yeah.
Tony, may I ask one question? So like I think a lot of people in the audience, right, they would love to do work with anthems in there, but often when you work with a big enterprise, it could be very, do you have any tips for small companies? How could they provide services for Anthem?
I don't think there's any limits on creativity and innovation. So I think even small companies we have worked with who come up with very smart, creative ways to improve healthcare. I think that we're open to all ideas. Yeah.
Okay, great. We would love to. Hopefully, more audience members do more business with you guys.
I'm going to follow up with this guy.
Okay. Thank you so much for that.